If you're over 60, there's something you might be overlooking. Something so common it's often dismissed, but it could carry a more serious warning. We're talking about an itchy patch of skin. But not just any patch. One that appears near your lower back, shoulder blades, or even the chest. At first, it might seem like dry skin. Maybe it's a harmless rash. You apply lotion, you scratch, you ignore it. But what if that persistent itch is a subtle signal from your body? A red flag for something deeper, something systemic. Doctors are beginning to pay closer attention to unexplained dermatological changes in older adults. One condition that's coming under renewed scrutiny is cutaneous T-cell lymphoma, or CTCL, a rare cancer that begins in the skin's immune cells. It often starts as nothing more than a red itchy patch. But if left untreated or undiagnosed, it can progress and impact a person's overall lifespan. And it's not just CTCL. Other underlying conditions can present in similar ways. For example, cholestatic liver disease, a form of liver dysfunction, can cause intense itching, sometimes before any other symptoms appear. In fact, pruritus, the medical term for chronic itching, can sometimes precede a liver diagnosis by months. Another concerning condition tied to persistent itching in older adults is polycythemia vera, a blood cancer that causes an increase in red blood cells. One of the hallmark symptoms? Severe itching, especially after a warm shower. Itching isn't always a skin-deep problem. In people over 60, a new or persistent itchy spot might be linked to metabolic disorders, nerve damage, or even kidney failure. When your kidneys aren't working properly, toxins build up in the bloodstream, leading to uremic pruritus, a widespread, relentless itch that can drastically reduce quality of life and even increase mortality risk. Dr. Ellen Marks, a dermatologist with over 30 years of experience, explains it this way. The skin is a mirror. When something goes wrong inside the body, liver, kidneys, blood, it often shows up first on the surface. But because itching is so common, it's easy to brush off. That's where the danger lies. So what should you watch out for? If you're over 60 and you notice a patch of skin that doesn't go away after a few weeks, becomes increasingly itchy, changes in color or texture, spreads slowly over time, doesn't respond to moisturizers or over-the-counter creams, it may be time to talk to your doctor. Unfortunately, delayed diagnosis is common. A study published in the Journal of the American Academy of Dermatology found that older adults waited an average of 11 months before seeking care for persistent itching. By then, many had already experienced disease progression. Why the delay? Part of the reason is that people associate skin problems with aging itself. Dry skin, thinning skin, minor rashes. They're often seen as normal. But there's a key difference between age-related dryness and a disease-driven itch. Age-related dryness usually improves with proper care. Disease-driven itch persists, spreads, and may even come with other symptoms, like fatigue, weight loss, or night sweats. In some cases, that itchy patch may not just be a symptom, it might actually be a prognostic marker. In patients with Advanced kidney or liver disease, chronic itch has been linked to a significantly reduced life expectancy. It's not the itching itself that's deadly, it's what's causing it. So what can you do? First, don't ignore your skin. If you're over 60, do a monthly self-check, just like you might for your moles or blood pressure. Look for any new or unusual areas of irritation. Second, keep a symptom diary. Note when the itching started, what makes it worse, what, if anything, helps, and whether you're experiencing other changes in your health. Third, be proactive with your healthcare provider. Mention the itching even if you're seeing the doctor for something else. A simple blood test, liver panel, or skin biopsy might uncover something that would otherwise go unnoticed. And finally, advocate for yourself. If you're told it's just dry skin, but it doesn't improve, ask for a referral to a dermatologist. Early detection can be the difference between manageable symptoms and a missed diagnosis. Your skin is not just a barrier, it's a messenger. And sometimes that message is urgent. If you're over 60, don't ignore the itch. It could be your body's quiet call for help, and listening might just extend your life. Let's take this further. There's also a psychological component to chronic itching in older adults that's often overlooked. Beyond the physical discomfort, persistent itch can disrupt sleep, cause anxiety, and lead to a reduced quality of life. In fact, studies have shown that seniors with chronic pruritus are significantly more likely to experience depression. They may withdraw socially, avoid physical contact, and even begin to feel hopeless, especially if the itch becomes a constant companion. So when we talk about a shortened lifespan, we're not just talking about biological outcomes like cancer or organ failure. We're also talking about emotional resilience, mental health, and the very real toll that persistent, undiagnosed symptoms can take on a person's well-being. Let's talk about neuropathic itch, a lesser-known but increasingly recognized cause in adults over 60. As the nervous system ages, nerve endings can become damaged, either from diabetes, spinal degeneration, or previous injuries. This can lead to phantom sensations, including a deep, maddening itch that feels like it's under the skin, unreachable, unrelenting. These cases are particularly tricky because they don't show visible rashes. The skin may look completely normal, but the urge to scratch is intense, even painful. In these situations, patients are often misdiagnosed or dismissed. They may be told it's in their head or be given corticosteroid creams that do nothing because the problem isn't in the skin. It's in the nerves. This kind of misunderstanding can lead to a dangerous cycle. The person scratches harder, lesions form, infections set in. In severe cases, repeated trauma to the skin can cause chronic wounds, especially in patients with diabetes or circulatory problems. These wounds are not only painful, but they also increase the risk of sepsis, gangrene, and death. This is why comprehensive evaluation is so important. A persistent itchy patch is not just a dermatological issue. It could be dermatologic, neurologic, hepatic, hematologic, or even psychogenic. Each possibility requires a different approach, and only a thorough workup will reveal what's truly going on. Let's also consider medication-related itching. Adults over 60 are more likely to be on multiple prescriptions. Blood pressure medications, statins, opioids, and even some antibiotics can trigger chronic itch as a side effect. This is especially true for medications that affect the liver or kidneys, which are responsible for breaking down and eliminating many pharmaceutical compounds. In polypharmacy cases, itch can appear weeks or even months after starting a new drug. Unless a doctor does a careful medication review, it's easy to miss the connection. And if the itch is misattributed to dry skin or eczema, patients might continue on the offending drug, worsening the situation and accelerating organ strain. In some cases, an itchy patch may even precede more overt symptoms of autoimmune conditions, such as lupus, Sjogren's syndrome, or dermatomyositis. These illnesses often have vague beginnings, with the skin acting as the first clue that something is wrong. Unfortunately, these signs are often dismissed, especially in older patients, as just one of those things that happen with age. But age is not a diagnosis. Age is a factor, not an explanation. And while aging does come with changes to the skin, thinning, dryness, slower healing, it should never be an excuse to overlook symptoms that persist, worsen, or impact quality of life. The question becomes, how can older adults protect themselves? Start with education. Understand that itching is not always harmless. Track it, photograph it, discuss it. The more information you bring to your healthcare provider, the better they can assess it. Next, build a care team that listens. If you feel your concerns are being minimized, don't be afraid to seek a second opinion. Dermatologists, hepatologists, neurologists, nephrologists. Sometimes the best insight comes from a collaborative approach. Then there's routine screening. Annual wellness exams should include a skin evaluation. And if you're at risk for diabetes, liver disease, or cancer, based on family history or lifestyle, make sure your screenings are up to date. These include A1C tests, liver function tests, and possibly even CT scans or MRIs, depending on other symptoms. And don't forget hydration and diet. Older adults are often mildly dehydrated, which can exacerbate itch. Nutritional deficiencies, especially in B vitamins, iron, and essential fatty acids, also play a role. What seems like a small lifestyle tweak can sometimes bring big relief. Finally, don't settle for temporary fixes. Over-the-counter creams, antihistamines, and home remedies may mask the symptom, but they won't fix the root cause. If the itch keeps returning, or if it evolves as from patch to plaque or from mild to intense, it's time to ask deeper questions. Because here's the truth, an itchy patch might be harmless. It might be a minor irritation, a passing rash, or an allergic reaction, but sometimes it's not. Sometimes it's your body's way of whispering that something is wrong before it starts shouting. And if you're over 60, listening to that whisper could be one of the most important things you do for your health. Not every itch will shorten your life, but ignoring the wrong one just might. So next time you notice something strange on your skin, something persistent, something itchy, don't brush it off. Ask questions, seek answers, and don't stop until you get them, because your life could depend on it.